Across the world, there are more than 1 million cases of COVID-19. We see to the south in the United States large number of increasing cases. And across Canada, there have been over 11,000 cases of COVID-19 and 138 deaths. The number of hospitalizations in the country continue to increase. Today, there are no new cases of COVID-19 in Prince Edward Island, so our total remains at 22. 4 people are considered recovered. We've done more than 1,000 tests here, and close to 140 of them done yesterday. I expect and hope to have additional test results later on today. As we mentioned yesterday, we are now doing some testing here locally for specific populations like certain healthcare workers and individuals in long-term care. And we've done a small number of those, and we'll be increasing that capacity for local testing, trying to double that capacity every 3 to 7 days. And of course, any positive cases that are determined here will need to be confirmed by the National Microbiology Lab, but and we'll speak more about that when that occurs. We want to speak about self-isolation and the importance of it, and we talk about it every day. But I need to be clear, if you're not complying with the measures of self-isolation, you are putting yourself and others at serious risk, and you can be fined. Our enforcement colleagues continue to issue verbal and written warnings for violating the public health order. Calls continue to be made, and we continue to take calls using the toll-free 1-800 COVID information line, and encourage those who wish, please use that line and we will call you back. 811 has even more people hired. Close to 80 additional staff have been hired, and increased training is occurring. Although, of course, we're very focused on COVID-19, I'd like to be clear that anyone requiring further medical attention for other conditions should call 911 or visit the emergency department. And this is especially important for people who may have underlying health conditions or such as heart disease. We certainly are concerned that we would miss something like a myocardial infarction or a heart attack if people do not seek the care they need if they have symptoms. As we head into another weekend, I'd like to re-emphasize that just because we do not have a new case today, that does not mean we should be complacent. In fact, it is the time that we need to be just as vigilant as ever. I expect the number of cases in P.E.I. to increase, and I expect that we will see cases in Prince Edward Island that will result in hospitalization. And that is why we're working so hard with these public health measures and Health P.E.I. to prepare our system. And it's important that we continue to self-isolate following travel, practice our physical distancing, and be diligent with the other things we've talked about time and time again, hand washing, for instance. I know we all want to get back to normal, and I do as well, but now is not the time. All Islanders, please remain diligent this weekend. We need to make responsible choices, and that will impact us going forward. And I know it's difficult. It is really hard. And in many ways, it seems almost counterintuitive that we're asking people to stay apart. But if we don't make these difficult decisions and choices now, it will influence the weeks ahead. If possible, stay at home, maintain physical distance, and if you are self-isolating, do so. And a reminder, it's those returning from travel who need to self-isolate from out of province or out of country, if you're a case of COVID, obviously, or a close contact of a COVID case. Staying physically apart does not mean disconnecting. It means finding new ways to connect with people we care about and those we love. It can mean video chatting with friends, talking on the phone, going outside and enjoying some fresh air, especially if you can stay, if you're not self-isolating, staying close to home. Baking with your children, doing a workout at the house, learning new skills. And Islanders are so resourceful and creative, and there's so many people offering great opportunities to keep people busy in their own homes. The better we are at implementing these measures, the better chance we have in P.E.I. not only to flatten the curve, but I'd like to think we could make it closer to a pancake. By doing something as simple as these measures, we can together save lives. Thank you. En français. À travers le pays, il y a plus de 11 000 cas de COVID-19 et maintenant 138 morts. Je suis contente de vous dire aujourd'hui qu'il n'y a pas de nouveaux cas. J'ai mentionné hier que nous avons commencé à analyser les tests ici pour les travailleurs de santé et les gens qui habitent les établissements de soins de longue durée. Et on travaille à développer notre capacité locale, mais nous ne sommes pas à ce point présentement. Si vous ne respectez pas les consignes, vous ne risquez pas juste vous-même, mais les autres qui sont très à risque. La pénalité, c'est des amendes. Et les autorités de contrôle continuent à avertir les gens quand ils ne respectent pas l'ordre public. Il est important de ne pas oublier que si vous avez besoin de soins médicaux urgents, appelez toujours le 911 ou allez aux urgences. Je sais que nous parlons surtout de COVID-19 ces temps-ci, mais n'oubliez pas 911 et les urgences, surtout pour ceux et celles qui ont des conditions peut-être de santé sous-jacentes. La fin de semaine s'approche, mais je m'attends toujours à ce que le chiffre ici à l'île du Prince-Édouard augmente et ça pourrait devenir des cas qu'on reçoit à l'hôpital. Ce week-end, je vous demande tous de continuer à faire votre part et ce n'est pas le temps de lâcher. Soyez responsables. N'allez pas rendre visite avec des gens qui n'habitent pas chez vous. Branchez-vous pour rester en contact. On vous demande de trouver d'autres façons de rester en contact et je vois la créativité des insulaires. Continuez à faire ça. Donc, tout ça pour dire que la meilleure chance qu'on a pour aplatir la courbe est directement liée à comment bien vous respectons les consignes. Rester à la maison, c'est un simple geste, mais ça peut sauver la vie à plusieurs. Merci.
Thank you, Dr. Morrison. Health P.E.I. continues to offer essential services only, and we're now reaching the end of our 3-week cycle of this and have reviewed our services. We're looking at specific patient needs which have been delayed to this point, and some of those may be recalled for services. If your procedure or appointment is being rebooked, you will be contacted by the service area. And a reminder to everyone to please call ahead to the area where you may have an appointment to ensure that it is going ahead. Our essential services plan will be reevaluated again over the coming 3-week period. The cough and fever clinics and drive-through testing sites continue to see more patients in both Charlottetown and Summerside. Yesterday, 129 patients were seen in Charlottetown and 51 in Summerside. Appointments to the cough and fever clinics are through referral from your family doctor or nurse practitioner or through 811. When arriving at the clinics, please remain in your vehicle until you're notified to come in by the staff on site. The assessment clinics are also now all providing an option for telephone assessments if necessary for individuals as well. Thank you.
Take some questions.
Nicole Williams, CBC.
Hi, Nicole.
Hi there. I'm wondering if Dr. Morrison, if you could just expand on testing here for COVID-19, what our capacity is, and sort of the role that the National Microbiology Lab will still play. Just want to get more details on how that all works.
So we're, as you know, we've been using the National Microbiology Lab, and we're very thankful that they have been helping us in processing our tests. And the local testing capability is something we're going to really appreciate it because it will help in the terms of the turnaround time. So we have an ability to do a small number of tests here, but hoping as I mentioned, every 3 to 7 days to double that capacity. So we've done, I think, 30 tests in the last day or so, and then we'll do some over the weekend as well if we need to, particularly those who need to, healthcare workers and those maybe in long-term care facility, and those are being prioritized, and then hopefully we'll get as we get more capacity here, that will mean that only the positives eventually may go to the National Microbiology Lab in terms of confirmation quickly, but they would be, but the tests here would be presumptive and then confirmed at the NML.
Thank you. And I'm also just wondering if you can update us on the conditions of our current COVID-19 cases. Is there anyone you're looking at in particular that might need hospitalization? Are there any of them that are experiencing more than mild symptoms?
Well, as I mentioned, 3 of them are considered recovered out of the 22, and there are none of the others are in hospital, but they are being contacted every day. Public health nursing is in touch with them on a daily basis.
Thank you.
Brittany Spencer, CBC.
Hi, yes, my question is for Dr. Morrison. I have a question about non-essential businesses sort of finding new ways to serve their customers at this time without having them come into stores. We're seeing some delivering books, music, things like that. And I'm just wondering what the public health recommendations are on this. Is this considered safe at this time, and are there any concerns about businesses that are considered non-essential taking up sort of a drop-off model?
I think really if we are looking at innovative ways that businesses can work and keep people safe, I think that has been fairly consistent. And where there is delivery options, I think that has continued. For instance, some of the retail stores that may not be considered essential certainly are still having online options available. So it's to try to make sure the staff in these retail stores, while they're working, maintain social distancing and do so safely, and that they're able to provide a service that is in a very safe way for everyone and protects the public and the staff.
Okay, thank you. And other provinces are moving towards releasing modeling for outcomes. I know Ontario is releasing some projections today for projections for how the virus will spread there. I guess where are we at with projections of what that spread might look like here? And do you have a realistic ideal scenario in terms of how many cases we could see here, hospitalizations, and how long this could last?
Well, I think it's a really good question. We are working on modeling and for this province, and I think the different provinces in the country are different stages of this outbreak and this pandemic. So I expect the federal government also to be releasing some modeling at some point going forward as well. We will be looking at projections how we look in projections to other provinces as well as other parts of the world. And so it's a little more challenging for us to do some projections based on fairly low numbers here, which of course we we want those numbers to be low, but it influences some of those projection curves. The assumptions that are going into those kind of models are very solid, and we're working with a great team of modelers that are epidemiologists, and so when those numbers are available, certainly we will be discussing them more publicly.
Thank you very much.
You're welcome.
Stu Neepy, The Guardian.
Hi, Stu.
Hi, good afternoon to you both. I just wanted to ask, I suppose this is a question I'll open up to both Ms. Dowling and Ms. Morrison. In terms of ramping up widespread testing, I mean, we've talked a little bit about what populations are being targeted for testing, but I'm wondering what consideration there is for testing people who might not have symptoms, like asymptomatic people. Are we simply relying on people to self-report symptoms before they actually get a test? What sort of proactive testing is kind of going on?
So it's a good question, Stu. So right now, based on what our evidence is here in Prince Edward Island, we are focused on anyone who really has any symptom to be tested. And we have over 800 tests which are negative, and certainly wanting to test more people. I think it will be something that we will be looking at going forward when we have broader community or any evidence of community transmission. We'll be talking about the criteria for testing. But we have the other thing we're doing is following up contacts who may even before the patient or the case has symptoms. And I think we are making sure we do that. So different ways of trying to get at those asymptomatic people. I think we need to be clear that despite the discussion on asymptomatic transmission, asymptomatic transmission is not driving the outbreak in this country or around the world, and it's something we need to pay attention to, and absolutely as we need to going forward, we'll adjust those testing criteria.
Okay, thank you. I guess one follow-up. I do get a lot of questions about staff in long-term care homes. So I'm just wondering if there has been any kind of more proactive testing of long-term care staff at all.
Not at this point, but they are very front of mind when we are considering everything in this outbreak and what we've seen around the country and around the world. And it is, if, for instance, one of the situations might be that if a resident was to become ill in a long-term care facility, looking at testing healthcare workers, even if they're asymptomatic. So that guidance is definitely under discussion this week, and we've been talking about it for a number of days. So wanting to make sure that is clear for long-term care facilities and the testing and the microbiology lab and those who would need to test. So I think they are a group that we also would be wanting to do those quick tests, and that was why the local capacity may be really beneficial.
Okay, thank you very much.
You're welcome.
Carrie Wynn McLeod, Ocean 100.
Hi, Carrie Wynn.
Good afternoon, Dr. Morrison. We've received a number of communications or concerns from people saying that screening at the Charlottetown airport just hasn't happened on numerous occasions when flights have arrived. And we understand that it would be difficult, to get people to turn around because of the mode of transportation, the same as you would ask them to do at the bridge. It's much easier to do there. But has there been any thought to perhaps having people at the gate where the flight originated and have people screened there before they're even allowed to board on the plane?
And I think you're speaking, Carrie Wynn, about essential travel or non-essential travel to P.E.I. So we actually have discussed that and discussed it as early as this morning. And we are screening people at the airport for sure, and trying to figure out exactly what options would exist if someone who is deemed non-essential to come by airplane, what would occur. As I mentioned yesterday, one of the things that has been increased and is increasing this week, that anyone who is supposed to be self-isolating when they arrive at either entry port, if they arrive at the airport, now will be contacted on a daily basis going forward, and to make sure they are self-isolating. And if we can't reach them, their enforcement will be involved in following up, and also making sure that they are well and that they have good supports in that self-isolation period. So I think, Carrie, it's a good question of, we talked about how do you make sure that it's clear before they get on the plane that non-essential travel is not recommended at this point in time.
And then, Dr. Morrison, has there been any plan or strategy put in place for when Northumberland Ferries begins to operate in a few weeks between Wood Islands and Caribou? What the screening measures would be there for essential and non-essential travel, and then if people are on the one of the ferries, would they have to stay in the vehicle in order to avoid being in a crowd, say on the cafeteria deck?
So we have not had a lot of discussions about the ferry at this point in time, but we will be, and we've been focused on the airport and the bridge, and of course the trucks only are coming across at the Magdalen Islands ferry. In fact, they're being loaded on one side and then being picked up by island drivers on this side. So, and if anyone is in a vehicle or a truck, they are being screened there. So those have been our three focus, but you're raising certainly another point of entry that will require more attention in the next couple of weeks.
Thanks so much.
You're welcome.
Rachel Collier, Eastern Graphic.
Hi, I was just wondering, is the old Riverview Manor building in Montague part of the COVID-19 response plan? And if it is, could you just expand on how it might be used?
Hi. Yes, it is part of our planning for our bed plan and a plan for surge and some capacity as a potential option for us down the road if needed. So some of the things that we've been doing to this point is looking at completing air quality testing, reviewing the building systems, because it was only fairly recently decommissioned. So we're looking at what the possibility is there to get it up and running. And we've been reviewing those building systems and getting them up to the current standards so that we could potentially use it for a surge in patients or create additional capacity in one way or another. So the firm plans down the road aren't complete yet as to what it could be used for, because we do need to see how the situation evolves, what type of care needs we are looking at, and then how we would use that space. But it is part of our planning, yes.
Right. And do you know if any other buildings might be involved in a similar way?
We are looking at a number of other sites for different things as part of our plan. Some of the sites we're reviewing are related to providing some potential staff accommodations for healthcare workers who are not wanting to go back home when we have COVID-19 patients in facilities, and so having a place for them to stay, and then looking at other capacity. But I don't have, there's a number of places that we're looking at. I don't have a specific list of them. And then, of course, we've used other sites for our drive-through testing and screening and assessment sites.
Thanks a lot.
Thank you. You're welcome.
Julien Lecachard, Radio-Canada.
Bonjour, Dr. Morrison. Dr. Morrison, selon vos recommandations, le ministère de l'Éducation a décidé que les enfants ne retourneraient pas à l'école avant le 11 mai, dans le meilleur scénario. Actuellement, le nombre de cas de la COVID-19 ne monte pas beaucoup à l'île du Prince-Édouard. Est-ce que vous envisagez un changement de cette date? Est-ce que les enfants pourraient retourner à l'école avant, ou est-ce que vous avez déjà dit au gouvernement qu'il serait peut-être préférable que les enfants ne retournent pas à l'école au mois de septembre et ainsi faire comme d'autres provinces, comme le Nouveau-Brunswick par exemple?
Alors, c'est une décision qu'on va avoir discussion avec le gouvernement dans les jours qui suivent. Je pense qu'on a fait cette annonce. On voulait avoir une date. Peut-être qu'on voulait que c'était une possibilité. Je ne serais pas surpris si c'est plus long que le 11 mai, mais on va avoir ces discussions dans les jours qui suivent. And I'll just translate it into English. The question was whether we have made any changes in the school date closure of May 11th. And although I would not be at all surprised to see that date extended, that will be a discussion we'll be having with government and education in the days that come.
Juste un follow-up sur ça, Dr. Morrison, avec une question peut-être un peu plus personnelle pour vous. Comment vous allez vous occuper de vos enfants avec l'apprentissage à la maison? Comment voyez-vous ça, l'apprentissage à la maison en tant que mère de famille?
C'est difficile de ne pas être là chez moi, mais mon mari aide beaucoup aussi. Il travaille à temps plein, mais il aide quand il est là. Et puis, je suis content que il y a beaucoup de choses qui vont être sur ligne, online, qui commencent lundi. Alors, c'est difficile, mais les enfants chez moi essaient de comprendre ça.
Merci.
De rien. The question was, how am I doing sort of with my children at home and me not being there and having them learn? And I said it's a challenge because I'd like to be there. But my husband, he works full-time, but he is really helping out in that regard and helping that teaching at home whenever he can.
Laurent Rigaud, La Voix Acadienne.
I guess my question is for Ms. Dowling. The WHO, the FDA, and some media reports expressed concerns about the drugs supply chain and a possible shortage of drugs needed for ICUs, for example. And we are seeing India restricting the exports of active ingredients and China. Do you share those concerns? And is a shortage likely in P.E.I?
Hi, thanks for the question. Medications have been something we have been monitoring in our supplies as well, and some of our critical supplies. I'd mentioned probably a couple of weeks ago, I think, that it was one of the pieces of our supply chain that we were monitoring carefully, and we had been placed on allocation from our suppliers. Some of the medications in particular are those ones where we suspect individuals who are ill with COVID-19 may need, and those who may require hospitalization may need. So those are the ones that we are reviewing and monitoring. So we do have concerns about the global supply chain issues, not just for the personal protective equipment, but absolutely for medications. And some of those specific ones. So we have been working with our normal vendors and suppliers and communicating that up through the federal government and the advisory committees that are in place around looking at the supply chain issues around patients with COVID-19.
Thank you.
You're welcome.
François-Pierre Dufour, Radio-Canada.
Bonjour, Dr. Morrison. Question pour vous en français. Pourriez-vous m'expliquer un peu le fonctionnement de l'analyse des tests qui se fait maintenant localement ici à l'île du Prince-Édouard? Combien de tests vous êtes en mesure d'analyser dans une journée? quels sont les tests que vous allez analyser ici à Lille en priorité et comment tout ça va se développer pour qu'on puisse analyser l'ensemble des tests ici éventuellement.
OK, merci. Alors, ici, on a la capacité locale pour en faire un certain nombre. On vient d'en faire juste à peu près 30 dans la dernière journée. On va essayer de doubler la capacité chaque 3 à 7 jours. Et en premier, c'est en particulier les personnes qui travaillent à l'hôpital, qui ont besoin d'être testés, avoir un test de COVID-19, ou les gens qui sont à Longterm care. Ils sont comme une priorité et on va commencer à en faire ici, mais on doit les envoyer à Winnipeg parce qu'en premier, c'est comme présumé, c'est pas confirmé. Alors, on va continuer à travailler avec la laboratoire national.
Et une question supplémentaire, si je peux me permettre. Hier, vous avez dit qu'hier, vous avez été en mesure de faire environ 140 tests dans la province. Est-ce que ça, c'est le maximum que vous êtes en mesure de faire dans une journée? Et comme le Nouveau-Brunswick, est-ce que vous craignez à un moment donné de manquer de matériel pour faire des tests ici?
Je pense que c'est le maximum, plus grand nombre qu'on a fait, mais et puis on s'occupe un peu, on regarde le nombre de tests qu'on fait, mais on n'a pas à ce moment un point de ne pas faire les tests qu'on a besoin. Alors, et j'espère que ça n'arrivera pas.
Merci.
OK. Thank you.